Hello, it's Dr. Kid here. In this video, I'm going to show you how to use the Ozempic injection. Ozempic, or semaglutide, is a medicine that mimics a hormone in our body known as the glucagon-like peptide 1 hormone. And what this hormone does is that it stimulates one of our organs known as the pancreas, which produces a hormone called insulin, and insulin helps lower our blood sugar levels. This is why the most common reason that we use this injection is for patients with diabetes, because people with diabetes have high sugar. Another reason I've been using it more commonly in my patients is for weight loss. And the way it works in these patients is that it helps lower their appetite a lot and therefore leading to weight loss. Ozempic is a once-a-week injection, and it's a small needle that you inject into your abdomen. The most common side effects include nausea and diarrhea. The way we try to mitigate these side effects is we start with a low dose and then increase it very slowly. So what we do is we start with 0.25 milligrams once a week, and we do that for 4 weeks. And then we increase it to 0.5 milligrams for 4 weeks, and then finally 1 milligram ongoing. Okay, so this is the injection. This is actually one from one of my patients, but they finished it, so it's good to use an example. So when you open it up, you'll get 6 needles in here, a pen, and an instruction manual. So we start off by opening up the pen, and this will be where the medicine is stored. You will open up your box of needles. As you can see, this one has been used already, but there is 1 needle left used for this example. Now what you do is, with this needle, you take this part off, and there's a little bit of a needle there, and you put the needle and screw it onto your pen. So once you have the needle attached to the pen, you take this big lid off first, and you'll save this for later because you need this to dispose of the needle. Then you take the small lid off, and you'll see the needle there. Now on this pen, because it's used, can you see there's a little drop just at the end of the needle? You may not have this when you have a new pen. So to make sure that you have a drop there so it's ready, you prime the pen by turning it to this sign here. Now this one's already primed, so it might squirt out a bit of medicine, but you press it, this button here. I'll show you, press this button here. As you see, some medicine came out, but then you should have a bit of a drop just at the end of the pen there. Then you dial the pen to the dosage desired. So we'll go up to 0.25 milligram. Went a bit over, 0.25 milligram, and then you're ready to inject. Okay, now that we've got our dose ready, 0.25, you will inject it into your stomach. Usually you inject it sort of in line with your belly button, just to the side, and you can alternate sides for different injections, but in this sample I'm just going to use a lemon. So you're going to hold the pen like this, and you're going to inject it into the stomach, or in this case the lemon, and hold it until you see the counter here go to 0. Once it goes to 0, hold it for another 6 seconds. Okay, so we're going to do it here. 2, 3, 4, 5, 6. Now that's actually a lot slower than it normally does. It usually goes in a lot quicker. I think it's because it's a lemon and it doesn't go in there very quickly. But that's basically how you do that part. Then you've got your outer needle holder that we had. Just slide it into the cap, and then you can remove it. You can put your lid back on, and that's it. You can put it back into the fridge and we'll be ready to use it in the next week. So to summarize, Ozempic is a once-a-week injection that's commonly used for treat diabetes or weight loss. It's important to remember that whether you're using it for diabetes or weight loss, that it is only an adjunct. It's not something that is the be all and end all. You still need to have a good diet and make sure that you exercise regularly. But if you're interested, definitely make sure you speak to your doctor, and I'll see you in the next video.